The coronavirus pandemic has shone a spotlight on existing imbalanced power structures, leading to calls to decolonize global health. Colonization, in this sense, refers to the idea that Western researchers and practitioners impose decisions and solutions on poorly resourced countries without involving people from those places. Researchers from the Global South have said that COVID-19 has held up a mirror to these inequalities.
We are in the midst of a crisis right now, in the midst of the pandemic, but I think we are on the verge of another crisis. It's going to start with, who gets access to the drugs that are showing good results, who will get access to the vaccines, because there is no way we will get a lot of vaccine at the same time. So all of these things will become really important, and I think resource-poor settings, people from the resource-poor settings will not be included in a lot of the conversations because they're already not being included.
Back in April, the World Health Organization chief, Dr. Tedros, slammed two French scientists for suggesting that vaccine trials should be held in Africa.
Africa cannot and will not be a testing ground for any vaccine. And the hangover from a colonial mentality has to stop.
Another example is the US's decision to buy up most of the world's stock of remdesivir, which is used to treat COVID-19. This will put patients in poorer countries at a severe loss. Some experts have also pointed out that it is nearly impossible to practice social distancing in slums or in refugee camps, while for most of the world's poor, accessing clean water to wash hands is really difficult. These solutions that originated in the West fail to take into consideration the lived realities of millions of people. Practitioners who have experienced this firsthand have said that this colonial mentality not only affects people, but also negatively affects the outcomes of the programs that are meant to better their lives.
When science is conducted with a colonial lens, so much is lost. We lose context, we lose capacity building, and most importantly, we lose translation of that science, because who are we doing that science for, right? Who's going to benefit from that science?
These calls to decolonize global health are coming at a moment of reckoning in the development sector. The ongoing Black Lives Matter movement has highlighted structural racism in many sectors, including development. It has also forced the sector to recognize some of the structural issues that lie at the core of this, like the lack of diverse staff at the headquarter level and how local staff in various countries often have no decision-making powers. Several organizations have published statements recognizing this structural racism and lack of diversity and have outlined steps on how they plan to tackle it. So as we emerge from this pandemic, what will it take for the global development sector to be more inclusive and more sensitive to the realities of the world around us?
COVID-19 has shown that we must be able to collaborate. We must be able to, to communicate, share ideas, learn from each other. But it must be done in an atmosphere of respect, so that everybody comes to that table and everybody's voice, is respected and heard. So I think going forward, there is hope. The fact that we're even having this discussion around decolonization of global health, that on its own is a good thing. I'm convinced that we're going to see results come out of this discussion.
We will continue to track how the sector responds to these calls for decolonizing global health, from equitable distribution of vaccines to who gets to really make the key decisions. For all that coverage, stay tuned to Devex.